Adhesive capsulitis. Adhesive capsulitis is also called frozen shoulder. Adhesive capsulitis affects the glenohumeral joint synovial capsule. In adhesive capsulitis, the capsule becomes inflamed and stiff. Adhesive capsulitis. The inflammation of the capsule is basically caused by diabetes, shoulder trauma, and inflammatory disease. Adhesive capsulitis. The inflammation of the capsule is characterized by limited movements, which include flexion and external rotation. Adhesive capsulitis. During the adhesive capsulitis, the pain increases at night and during performing the movement. Stages of adhesive capsulitis. There are 3 stages of the adhesive capsulitis. Stage 1, freezing stage. Stage 2, frozen. And stage 3 is thawing stage. Stage 1, freezing stage, in which pain increases accompanied by increasing stiffness. Stage 2, frozen stage, in which decreasing pain with the stiffness remaining. Stage 3, thawing stage, in which stiffness decreases and returns to normal.